In this video, let's just talk intubated and sedated. General ICU assessment is quite long and quite detailed. The big difference is the amount of lines and equipment that you're going to check to make sure is appropriate, and different safety considerations just because of higher alert meds, drips, also restraints and alarm parameters and that kind of thing. And for those who don't know, I have a full course, a crash course for new ICU nurses. It's called Breakthrough ICU. There is a hyperlink in my profile if you want to check it out. When I have a sedated patient, I want to assess their level of sedation, and typically it's a RASS score, R-A-S-S. So you're going to have to chart that, and the parameters for that are in the documentation. So you'll say how sedated they are. You don't want too much, but you also don't want too little either. And it all depends on their goal of care. And sometimes they're going to have to do a sedation holiday, and sometimes they don't want that. So you got to know, am I pausing sedation or not? When you have a sedated patient, you can check their gag, you can check their cough reflex with the ET tube, and you can check their blink and corneal reflex. So those are important to know, the blink and corneal. So, you open their eye, and what you want is to kind of look like you're going to poke them in the eye, and you want to see if they're going to try to close their eye. You want to see if their brain can interpret, oh, there's a threat coming towards my eye and I need to close it. So if I've got my patient and I'm opening their eye and I'm slowly putting my finger in front of their eye, and they attempt to close it, even if it's weakly, barely, that counts. Hey, that's good. Now if you do that and they don't move at all, they don't interpret that there is a threat coming to their eye at all, that's bad. So now we need to kind of up the ante and go to a corneal reflex check. So what you can do is get some saline, those little saline bullets is my favorite thing to do. And open, and some people will get maybe sterile gauze. And I like the saline better, and I will squeeze a little saline, and I'm going to see if when that saline hits their eye, if they attempt to close it. Okay, and if they attempt to close it, again, even if it's very weakly and poorly, if there is an attempt, and that counts positive, that's good. We've got a positive corneal, and we want that. But if there's no movement at all, that's kind of bad, and that's negative. So you want to document that kind of stuff. But you also want to check, hey, can they follow commands? Can they squeeze? Hey, show me 2 fingers. Give me thumbs up. Wiggle your toes. What kind of muscle movement do we have? What kind of tone do we have? Here's my assessment checklist that's in my Breakthrough ICU course in my assessment module on assessment tips for the ICU.